Hawaii is a unique state with unique politics, and we deal with things a lot differently than the way that people on the mainland might deal with faith, family, and freedom. And today we're going to talk about an issue that really has come to the forefront because of the situation with COVID-19, and that's the ability for people in our great state to balance personal responsibilities with the protection and what's in the Constitution. And I'm hopeful that after the conversation today, you're going to be able to answer the question of what constitutes an emergency power, and how does the governor and mayor have this ability to do what they do during situations of crisis. So stay tuned and let's dive right in. All right, aloha everybody. I am Eva Andrade. I'm the president and CEO of Hawaii Family Forum, and I'm pleased to partner with Kalo TV to bring this informational chat fest to you on issues that are facing Hawaii's families, especially the faith-based community, because we live, we breathe, we work here in this state, and we provide a lot of good things. Today, we're going to be talking with Jim Hochberg. He's an attorney that has been here in Hawaii for at least 30 years fighting for religious freedom. And Jim and I go way back. We have a long history of working together to fight for you, the faith-based community. And what we're going to be talking about today is we're going to be talking strictly about the emergency orders that the governor did on the very first one that came out on March 4th, all the way up until the most current one. All right, well, so Jim, there were specific things that you wanted our viewing audience to really get a handle on these emergency orders. So what do you want us to really understand about that very first emergency order, the one that just came out, and then all of the numbers that have come out from the health department to back up these emergency orders?
Okay, so the theme for my take on current COVID-19 situation in Hawaii is on the sign up behind me. What are the facts now that support the emergency? That's really what everybody needs to be thinking about. And in order to talk about that, because we have a half an hour, we're going to focus on three documents that have been running around from the government. Now, at the beginning on March 4th, there were assumptions that were made that turned out to be wrong about COVID-19's infectiousness and effects of it on the bodies and who was going to die and all that stuff. So because we didn't know then and we still don't know now exactly the details, because I don't know whether I can get the virus from you over the internet, I'm going to do this with a mask on because I don't want to die. No, I'm not going to do that. So I am an attorney. I've been an attorney since 1984. I'm actually a Liloa High School graduate. I've been here. This is where I grew up. I was not born in Hawaii, but I moved here in elementary school, and there you go. So basically, in a nutshell, the Constitution gives us freedom, and it doesn't give us freedom. The Constitution tells us that God gave us those rights and freedoms, and the government can't take it away. The statutes in Hawaii tell us that sometimes if there's an emergency that meets the definition in the statutes, the government can exercise some powers for 60 days. And we're way past 60 days, and we need to know whether the emergency facts exist or not, hence that message on that sign, which I hope everybody comes to the Capitol at noon every Friday to protest. Got a bunch of signs like that I'm happy to let people use. So I got to put my glasses on because I got to read some stuff. So on March 4th, the governor did an official proclamation. And he said, because COVID-19 has rapidly expanded and is reportedly spreading from person to person, you got to put yourself way back there. Reportedly, they didn't know what they were talking about. And he says, whereas the World Health Organization declared the outbreak of COVID-19 a public health emergency of international concern. And whereas on January 31st, the federal government declared the outbreak a public health emergency for the United States of America. And whereas COVID-19 is rapidly spread around the globe and in 78 countries, And where in the United States, there's at least 108 confirmed and presumptive positive cases of COVID-19. This is March 4th, okay? I'm starting to feel like Mark Levin. Anyway, and they go on. March 4th proclamation. COVID-19 continues to evolve and spread around the globe and is now spreading in the community, not just travelers in China. So March 4th, they're still not focused on Hawaii. Whereas COVID is highly contagious. That's what we thought. And it's probably true, just like the flu is. Whereas on March 4th, the World Health Organization reported 93,090 confirmed cases worldwide. And whereas COVID-19 has proven to be fatal, with 2,984 deaths reported in China and 214 deaths reported outside of China. March 4th, this was what they were believing, okay? And that's why I want us to talk about this stuff. Whereas on January 31st, President Trump declared a health emergency and issued an order limiting flights from China. And whereas the Centers for Disease Control directed the quarantine of people traveling from China. Way back in these facts. So I keep saying that because this order is the only set of facts that the governor relies on for the supplemental 2, 3, 4, 5, 6, 7, 8. Every one of his supplemental orders says, like we said on March 3rd, March 4th. Okay, so let's keep looking at the facts. Based on the actions and directives of the president, the World Health Organization, the United States Centers for Disease Control, and current conditions, March 4th, current conditions, the danger is significant so as to warrant preemptive and protective actions for the people of this state. There was nothing in that order that said we even had a single case in Hawaii.
So what do you say then to the people that are out there saying, well, the reason that the numbers are so low is because of the social distancing, because of the stay-at-home order, because they took this view of protecting our vulnerable among us? What do you say to them?
I heard all kinds of talking heads on TV say you can't really prove that, but even if it was true when it was necessary. And once we've learned that it's not necessary, it's not true, and therefore it shouldn't be law.
We have our
let me put that in this context. If we were in any other state in the country, that question would have a lot more weight. But we're out in the middle of the Pacific Ocean, and we've pretty much stopped people from coming here to bring it with them. And that leads me to what the health department of the state of Hawaii lists every Friday as the aggregate number and current number of cases, hospitalizations, released from hospital, and deaths from COVID-19 in the state of Hawaii by county. And before I get into those specific numbers, which are the facts upon which we're asking what's the emergency, the reason is in this March 4th order, after all of those conditions, they say, whereas this occurrence of COVID is a severe, sudden, and extraordinary event, it has the potential to cause damage, loss, and suffering of such character and magnitude to affect the health, welfare, and living conditions of a substantial number of persons and to affect the economy of the state of Hawaii, and is expected to be of such a nature as to warrant rehabilitative assistance from the state, and the danger of disaster is of such magnitude to warrant preemptive and protective action to provide for health, safety, and welfare. They're never addressing whether they still believe that that's true. The health department stats show it's not true. It never was true in Hawaii because, unlike the other states, we're in the middle of the ocean. We are self-contained, so if we don't have very many incidences of COVID, we don't have very much infection. And out of the infections that we've had, we had 17 people out of 1,400,000 die. 17. I would love to see a list of causes of death in these same 5 months in Hawaii from every other cause and see how far down the list that 17 is.
You know, you bring up a good point that I haven't heard many people talk about, but it's very interesting. So across the nation, not only in Hawaii, when someone passes away, they actually list COVID-19 in those cases as the cause of death. And there's been a lot of talk that it may not necessarily have been the COVID-19. It might have been the underlying medical condition they had, you know, whether they had COPD or, you know, other issues. What I thought you might find interesting, and I don't know if you've made this connection or not, but do you remember when we were fighting assisted suicide in Hawaii, one of the questions that was brought up is how are they allowed to falsify the death certificate, right? Because they said, oh no, we cannot let people know that it was assisted suicide that they passed away on. You know, no, we're going to list their underlying disease as their cause of death. Why do you?
Yeah.
Why do you? Doesn't this seem kind of you know, they're diametrically opposed to each other? That same argument. Why do you think that is? I know I'm kind of putting you on the spot there, but I find that very interesting.
Okay, so now you're asking me to put on my political philosopher hat.
Yes.
I have a couple of them. And I have come to really believe that it is true that there is a political philosophy that in America that a substantial number of people in power subscribe to, which says what my mom always told me wasn't true. My mom was a good Catholic, and she always said, Jimmy, the ends don't justify the means. But there is a huge political movement in the United States that sees that as exactly appropriate, that the ends do justify the means. And we end up with all kinds of inconsistent, illogical, and apparently untrue positions taken by the same people on different issues, because truth and honesty isn't a value. Winning is the value, and therefore the ends do justify the means. So on the one hand, we can say we don't want to put the real cause of death on a death certificate, suicide. We're going to put their underlying cause, whether they had cancer, whatever led them to want to take the medication. But on the COVIDs, we're not going to put the underlying disease. We're going to say they died from something that they may not even have died from. Why? Because it pursues the winning in the politics that group is pursuing. That's my philosopher.
And I know I agree with you. And I think that the message that I'd like our viewers to see is this is why we constantly try to get the people in our beautiful state involved in these issues, because our legislators right now can pretty much do what they want in Hawaii. You know, once you're elected in Hawaii, you tend to stay in office because we have our different reasons, and maybe we'll do a show about that. But the point is that, as Jim always likes to tell people, our politicians aren't supposed to govern us by bullying, because we elect them. We put them there. They work for us. And I think that we need to hold them accountable when these kind of laws are passed that doesn't make any sense whatsoever. And I think that just a reasonable person could say, well, we're lying on this death certificate, but we're not lying on this one. Why is that okay? Well, it shouldn't be okay. And I think we do need to hold our politicians accountable. So Jim, going back to the health numbers though. So Lieutenant Governor Josh Green, who is a doctor and he has worked in the emergency room, he tends to agree with what you're saying, at least in his statements, is that we're looking at the numbers here in Hawaii. They're very low. You know, we should be somewhat safe to start going about our business. Does that validate you when the Lieutenant Governor comes out and makes these claims that seem to balance with what you're saying?
When people say things on television, it's not the law. And if we remember, the Democrats tried to hang President Trump in court over immigration policies in the very beginning of his presidency because of things he said in rallies. And the courts properly said, what he says at a rally isn't the law. So I like Josh Green saying that, but he's sitting in the wrong chair. He doesn't matter.
Well, I think, and the reason I bring that up is because you know as well as I do, people out there that don't stay up on top of things as much as we do, they hear something on the news or they see something in somebody's tweet or on their Facebook, and then they go, oh, this must be the new law or the new rule. And that's not the case. And I
It's
think
not
that's
the case at all. In fact, even when Governor Ige does a press conference after he signs a supplemental order in this COVID emergency, his posters have misrepresented what's meant in the order itself. And when somebody points it out to him after the press conference, he has to walk back that point because it wasn't consistent with the law, the order. So let's look at these health department numbers, because if you lived in New York, state of New York, think they have, I don't know how many people, tens of millions of people, 100 million people. No, they can't have 100 million. California has 40 million. They probably have 50 million. Maybe they have 40 million. But they have huge numbers of deaths, huge numbers of hospitalizations. Remember, everybody thought this was such a bad virus that the hospitals weren't going to be able to handle all the need for medical. Didn't turn out to be true. Even in New York, even in New York City. Okay. Well, Hawaii isn't populated as densely as New York City. And like any other kind of infectious disease virus, you don't get it if you stay all by yourself. It's when you're close to other people, and the more dense your population is, the closer more people are to each other, which is why the whole time my kids were in elementary school, my family was always sick. Somebody always had something until they got out of elementary school. Because I guess after elementary school, they don't touch and all that stuff as much or whatever. But so let's look at the Hawaii Health Department statistics. This was as of Friday, the 15th of May. So this was last week, Friday. This afternoon, we'll get another one. It will have one extra infection because we had one since last week. So the bottom line numbers are, as of last Friday, the total number of reported cases, 638, I believe. Could be 58. It's very small print. We had one new case in all of last week. So before last week, there were 637 or 57. The total released from being in isolation because of COVID as of last week, Friday, was 565. So there are 75 people. And 17 died as of last Friday. So between those released from isolation and those who were found to be positive tested, there were 75 who, they don't tell us, maybe didn't actually have symptoms or whatever. So when you have 1.4 million people in a state and you have 17 die and you only had 638 or 58 total cases, that doesn't meet the definition in the statute of an emergency. The statute that gives the governor the power is Chapter 127A, and Section 2 defines emergency as any occurrence or imminent threat thereof which results or may likely result in substantial injury or harm to the population. Not to the individuals that got sick, not to the individuals that died, but to the population, to the 1.4 million people in the population. Less than 1,000 people infected in Hawaii is so small that every week when the CDC publishes its national numbers, they don't even put Hawaii on their list. They cut off states that have less than 1,000 cases because it doesn't matter to the CDC. If it doesn't matter to the CDC, probably a reason CDC's operating on emergency powers too, and it's not substantial harm to the population. So that's why I think this is the question we need to all be asking of the governor and the mayors now, as often and as seriously as we possibly can. What are the facts that create substantial injury or harm to the population of the state of Hawaii?
So we've gone from, in the very beginning, as of March 4th, there was an uncertainty, and as you said, they were basing what they did on March 4th on assumptions, right? This is what we think could happen. Let's make this rule. But now we move the bridge along, and we're getting the numbers. So the
Do you know how
facts are
hard it
now
is to
happening.
move a bridge? We can't move a bridge.
We're
What we can
moving
move,
on the bridge.
we can move on the bridge. Yes.
Yes, we're
And
moving on the bridge.
when we move from that position on the uninformed supposition side of the bridge to the informed side of the bridge, we find out there is no emergency. I'm sorry. That doesn't mean that people should do whatever they want. People need to be responsible. If you happen to be in a personal situation where you may be at risk because of your age and your underlying medical condition, you know, maybe you do want to stay home. I have a friend at Bible study that's like almost 80, and I call her all the time and I say, would you please, I saw you at Costco again. Call me and let me do your shopping. But she says, no, I feel fine. I like going to Costco. That's her choice. That's what it should be, because under the Constitution of the United States and the state of Hawaii and the laws of the state of Hawaii, except for this chapter 127A that creates these emergency powers, the government cannot restrict us absent an emergency. And if we don't have an emergency right now, I don't care that the governor and the mayor this week say, okay, now you can go to church if you social distance, if you don't sing, I don't know, whatever their restrictions are. If there's no emergency, it's up to us individually to decide how we're going to safely do it. And I think people in Hawaii, maybe more than people anywhere else, because we live aloha and we got an awful lot of kokua for other people, we're not going to do it stupid.
So as we wind down on this half an hour, you always have so much good information and time goes by really, really fast. What is the penalty? So, okay, they're opening up now. They're saying, you know, as long as you kind of take these considerations, you know, you got to have your 6 feet, you got to have your mask, you got to be able to clean in between. You can't have a full service, you know, it's going to be a not as many people allowed and all that. What is the penalty if a church decided tomorrow, I'm going to let everybody in, and when I don't care about masks or social distancing? What is the penalty for not following these proclamations that come out from the governor's office?
Okay, so it depends on what action you take when you've been told by the government you're a violator. So what they're doing is giving citations, like tickets, to people. Some people get arrested because they do dumb stuff. They get up in a cop's face and tell them they're Nazis for, you know, enforcing these laws. And I think there are ulterior motives for wanting to get arrested. But you get a ticket. The ticket can have a $5,000 fine, and it can also end up in a year in prison. The judge has the authority to go that high. So it can be anything from nothing to there. The law also allows the governor's office to sue you in court and ask the judge to give you an injunction prohibiting you from doing whatever it is you did. What I think the better result is that if somebody gets a ticket or is served with a complaint for an injunction to stop violating these orders, the first thing they need to do is ask, what are the facts that support the issuance of the latest version of the order, because there's no emergency? I want clients so that I can sue and let the governor's office and the mayor's offices tell a judge what they think the emergencies are. Because this is my evidence, the health department stats. I don't know what they're going to come up.
That's really good. So maybe in the next show, we'll actually talk about at least the basis for your lawsuit and all of that coming up. As we end this little chat session, we do want to make it clear that we are very appreciative of all the first line responders that are out there, the police department, the hospital workers, people in the social ministry issues that are out there helping people get food and pay their rent. And we are appreciative to the lawmakers that have spent a lot of time trying to get through all this. We're not saying that we're not grateful for the hard work. We're just saying that there are questions that you, as an active participant in this community should be asking. And we thank Jim Hochberg today for really drilling that home for us, that the question we want to ask is, what current facts support an emergency? So if you want more information, please visit us on the web at hawaiifamilyforum.org, or you can visit Jim at his website at jameshochberglaw.com. And we hope that you'll stay tuned for the next episode that's coming up. Mahalo for joining us today.
Aloha.